So let's talk about another childhood autoimmune disorder, and that is systemic lupus erythematosus. We do see that in the adult population, but we do see it about 15 to 20% of the time it's diagnosed in childhood. So lupus is a chronic inflammatory autoimmune disorder. And the difference about this autoimmune disorder is that it attacks many organs, and we really don't know what its cause is. We believe there is some element of genetics involved. But from there, we're not really sure what leads one to develop lupus. So those that may have that genetic predisposition towards the disease get triggered by some sort of environmental trigger. Something triggers the immune system response, and it's an abnormal stimulation of that system in that it causes the body to attack its own tissues. In the process of doing that, the body produces autoantibodies, and those autoantibodies combine with the antigens to form these immune complexes. And it's these immune complexes that create a lot of the problem in patients because they deposit themselves in various different types of connective tissue. Once we deposit these foreign agents, if you will, into this connective tissue, it triggers an inflammatory response in that tissue. And of course, then that leads to our inflammatory response and destruction of that connective tissue. The most common tissues affected with lupus are those small blood vessels, the spleen, and the heart valves. So you can see those are pretty significant areas where damage can occur. So some clinical manifestations, whether it's a child or an adult, the most classic sign and symptom is the picture you see on the upper right-hand corner. We refer to that as a butterfly rash, and it's located over the bridge of the nose, and it extends like the wings of a butterfly onto the cheeks. This is a characteristic sign and symptom of lupus. Additionally, we may see other organs involved, and the signs and symptoms reflect those organs that are involved. So if we have an acute episode of lupus, we may have nephritis, arthritis, or vasculitis, any one of those areas being affected, or it could be a gradual onset that we note over time. Children with lupus will have some reflective changes in their blood, such as anemia, leukopenia, and thrombocytopenia. And we may actually notice some central nervous system complications due to the complications with blood flow and vascular blood flow and oxygen to the brain. Other signs and symptoms, another classic sign is Raynaud's phenomenon. That picture on the bottom right shows fingers that are turning white or blue in the cold. That is typical of Raynaud's phenomenon and is common in patients with lupus. Additionally, they may have some blood pressure issues due to the damage to the blood vessels, shortness of breath, joint pain due to issues with arthritis. Treatment is really to get patients into a remission and try to combat and control the inflammation. And so the primary form of treatment is steroid therapy, and it's generally long-term steroid therapy. And we know that the effects of long-term steroid therapy can be a real problem for patients as well. In particular, what we classically see are that patients will become much more immunosuppressed and much more likely to develop infection. They will develop that classic moon face. That top picture of that little girl showing before and after steroids is a good description or picture of moon face. They also go through some bone loss and become very, very susceptible to fractures, osteoporosis, and other things because of that. So we do need to pay attention to not only treating them, but also the side effects of the medication we use to treat them. We also find, interestingly, that anti-malarial medications do help and treat some of the symptoms in patients with lupus. Otherwise, we are treating for pain as well. So NSAIDs commonly are used. And the final form of treatment we use is to give them immunosuppressant therapy and medications to help keep them from attacking their own bodies. So we've got them on immunosuppressant medications and also on steroids that immunosuppress them. And that is what leads these young patients to being very susceptible to infection. Finally, I just want to mention that we can never forget the developmental level of our patients when we talk about disease processes. And adolescents are very, very concerned about their appearance, as we know. And when we add to it this butterfly rash and complications with joints and swelling in joints and an inability to function in quite the same fashion, when we are dealing with some of the changes that occur, it's very important that we remember the developmental level and that we're addressing those things with that young adolescent population.